So why does mucormycosis or black fungus actually take place? What are the causes for it and how is it increasing at such an alarming rate in the country? Dr. Guleria explains.
कोविड के कारण और कोविड की ट्रीटमेंट के कारण इसके केसेस अब काफ़ी ज़्यादा देखने में आ रहे हैं। कई क्षेत्रों में काफ़ी अधिक मात्रा में केसेस रिपोर्ट किए जा रहे हैं। अगर हम एम्स की ही बात करें तो हमारे यहाँ ऑलमोस्ट 23 केसेस हैं जो भी एडमिटेड हैं जिनको ये फंगल इन्फेक्शन है कोविड के। 20 उनमें से अभी भी कोविड पॉजिटिव हैं और 3 कोविड नेगेटिव हैं। बहुत इंपॉर्टेंट कारण है मिस यूज़ ऑफ स्टीरॉइड्स। स्टीरॉइड्स जो पेशेंट्स ले रहे हैं, जिनको डायबिटीज़ हैं और साथ में कोविड है, अगर ये तीनों चीज़ें इकट्ठी मिल जाएं तो वो चांसेस ऑफ फंगल इन्फेक्शन एकदम बढ़ जाते हैं।
All right, so you got a glimpse of it with Dr. Guleria. Let's take this discussion forward with our guest this morning. We've got Dr. Avinash joining us from the Max Healthcare, and we also have Dr. Romel Tikku. Beg your pardon, Dr. Romel Tikku is from Max Healthcare, and we have Avinash joining us. He's the president of IMA in Maharashtra. Dr. Avinash, first to you. We heard Dr. Guleria saying that this happens mostly in COVID cases and happens mostly with people with diabetes who've been administered steroids. Is that only the case, or anybody who's taken steroids needs to watch out for symptoms, need to be careful about black fungus?
Black fungus or the mucormycosis is not a new disease as such. Only thing, it was quite rare rather for years together. In the first wave also we have seen a few cases of mucormycosis. Nowadays, because of this second wave, the number of cases have been increased quite a lot. The main reason that the body resistance of the person is at low level is the first thing. And if he is having some disease like HIV, other than of course COVID, he has HIV or undergone some cancer treatment, then maybe those who undergo the organ transplantation, these people have some immunity problem or their immunity level is low. So when they are given steroids, the immune system also gets, you can say, suppressed, and the chances of getting these type of infections are more. So this is the main thing.
Okay. So if I'm hearing you correctly, you're saying if you have a comorbidity and then you got COVID and treating it, steroids were used, then you can develop this. But let me come to Dr. Tikku on this one. Dr. Tikku, then the question is, when Dr. Guleria says that overuse of steroids, something which is being talked about more and more now, what exactly does it mean? Could you explain to our viewers? I mean, doctors understand that there is a window and at a stage when you need to administer steroids, which obviously is not happening at this point in several places. The impact of that is being seen in black fungus as well. If you could just explain that for to our viewers as well.
Well, steroids are life-saving in critical patients of COVID, but they're being used injudiciously now because indiscriminate use has led to these mucormycosis cases. We have plenty of cases now in Gujarat, Maharashtra, and even in Delhi for that matter. See, the indication for steroids in COVID is only in the second week. The first week, when you have flu-like symptoms, steroids are not indicated. The viral replication happens in the first week, and you use antiviral drugs and symptomatic treatment, or things like ivermectin, for which we don't have enough data as of now. It's only in the second week when the disease progresses, when you sort of have ongoing fever, the cough worsens, your inflammatory markers in the blood go up, and you might need a CT scan or a chest X-ray. And when your lungs get involved, you get a pneumonia, you're in respiratory distress, you need oxygen, that's when steroids have a role to play. And the recovery trial, and enough data which comes from UK has already told us that steroids are life-saving in such patients. But if given to patients who don't have respiratory distress or not having a need for oxygen, it might actually worsen the condition and increase the mortality. So we've seen that a lot of patients, So we've seen that a lot of patients are taking steroids from day one because somebody in the family had it and he was given steroids. Or for that matter, even some doctors have been prescribing steroids from day one. And what happens is it masks the symptoms. Your fever might go down, your CRP inflammatory markers might go down, but suddenly in the second week, there's a fulminant pneumonia that you have to deal with, and you land up in the ICU. And we've seen plenty of patients having such issues. Now, steroids, even for a brief period, do not give you too many side effects. But yes, the sugars do go up, which is temporary. But again, with diabetic patients or immunocompromised patients, transplant recipients, or somebody who's having an autoimmune disorder, is on immunosuppression steroid, can land up with things like mucormycosis.
Right.
Plus the fact that, apart from the fact that in some centers, they're using very high dose steroids, which is not recommended. It's the high-end antibiotics and tocilizumab. All these drugs also reduce your immunity. You're already immunosuppressed because of your underlying disease. Then COVID itself reduces the immunity, and then these drugs.
Can I just pause you over there, because you've said something very important. You are saying steroids, if not used judiciously, will not just not help, it would actually harm. And black fungus is just a fallout of that. There could be other harms as well that could happen as a fallout of that. Very important clarification that I'm getting from you. Dr. Avinash, then, you know, steroids are not really used in other viral drugs. For example, for influenza, steroids were never used. But now COVID, it figured out that it was having a good impact, so now people are using it. And I completely agree with Dr. Tikku when they say that a lot of people in the family also feel that, oh, that so-and-so person took steroids and now is fine, so maybe I should just get started on it as well. So there's a pressure building up from patient side on the doctors also to prescribe. But doctors need to be very careful. And the increasing cases of black fungus should be a wake-up call to all those people.
You're right in a way. Basically, those who are on home isolation mostly do not need steroids. Only when their oxygen level goes down, and the other symptoms and the investigations of the markers show that they are having a very severe cytokine storm. So these people may need steroids. In hospitals, whenever the patient is admitted, the decision is taken by the physician who is treating. I must say that not every patient who is having diabetes with steroid treatment gets mucormycosis. Not every patient who is on steroids gets mucormycosis.
Of course.
Yeah. So there is what Dr. said, that it should be used. First thing, judiciously, whenever it is required. The things are very clear. But the decision is taken by the treating physician who is actually dealing with the patient. And most of the time, it is rather the doctors are unnecessarily, it is their charge that they are using it unjudiciously. Basically, the steroid is a life-saving drug.
Right.
It's the best drug in best hands. You can say that it cuts both ways.
Right.
If you use it rightly, you can save the patient. But the most important thing, care after disease is very important.
Right.
Because most of the patients they are getting once they are discharged. So two things are observed. That the patient, all these steroids are gradually tapered off, but most of the patients just stop when they get stop all the treatment once they get discharged from the hospital. And secondly, the other cleanliness and other things, even in the hospitals, like the oxygen cylinders and the other our air ducts of the AC, air conditioner system, even at home, the cleanliness and everything should be taken care of.
I'm getting a bit of audio trouble on your line. I'll just try and fix that, and producers will take care of that, sir. But if I caught on to most of what you're saying not everybody will get it, of course. But even if you are on steroids, you need to gradually taper off. You can't just, get off it immediately. And post-care, if you've taken steroids, is also quite important. So what exactly is the function of a steroid, and how and what does it do to your body? Dr. Tikku, can I just understand in very basic terms really from you on what happens to your body once you take a steroid? What I understand so far is that you only take it when you know that your body's immune system is not going to respond anymore. And if you have a bit of a fighting chance also, doctors, or at least, the latest studies are at least talking about that, try and take a more developed antibiotic, try and help your own system fight it out before you administer a steroid. Is that correct? So what exactly happens in your body when you give yourself a steroid?
Steroids have an anti-inflammatory effect, and what happens with COVID is in the first week it's all about viral replication. So if you use it in the first week, it increases the viral load actually. In the second week, there's the inflammatory phase when the lungs get involved and there's inflammation happening in the lungs and all over the body. Lots of systems get affected. So steroids, because they have an anti-inflammatory effect, they reduce this inflammation happening in the body, especially in the lungs. And in certain patients, there's a hyperimmune response happening to the virus infection. So it brings down that hyperimmune response and brings down the inflammation which is going on in the body. And you get into a cytokine sort of storm in certain patients who have a worse kind of disease and the hyperimmune response that they have. So basically, it's all about anti-inflammatory effect which the steroids have. But the flip side is that they suppress your immunity. And if you are diabetics or if you have an other immunocompromised state or comorbidity, or if you are a transplant recipient, cancer patient, then it does sort of depress your immunity further and you might catch some opportunistic infection like mucormycosis or for that matter some secondary bacterial infection.
Do people who've been on ventilator also run a risk of getting black fungus, and do they need to be careful?
Yes, of course, because they are critical patients of COVID, and sometimes what we've heard is that even the humidifiers might be carrying the fungus, and we need to be careful about the supplies of the water, everything, because they can also lead to a surge. But at the end of the day, you have to be immunocompromised. As the doctor rightly said, not every patient can get mucormycosis. It's basically a combination of an immunocompromised state, very high sugar levels, diabetes, that itself creates a fertile ground for such infections. Having said that, we have seen mucormycosis in the first wave also, but because there's been an exponential increase in the numbers in the second wave, so we are seeing increasing numbers. It is a rare infection and the mortality is more than 50%. Most of the times you need a surgery, removal of the tissues on the face, nose, sinuses, very disfiguring surgery. And on top of that, you need a long-term antiviral medication, antifungal medication, and those drugs, amphotericin B, is also very expensive. So we have to be very careful. We don't have to use steroids for every patient, and people also have to understand the ones who are under home isolation, they can be given steroids, but it's only in the second week and under medical supervision when they have some sort of lung involvement and their saturations are dipping. On their own, they should not be starting steroids. They are helpful, they are life-saving in critical patients of COVID, but when given to mild cases, it can create more problems, increase their viral load, and actually progress their disease from mild to moderate to severe.
Right.
State.
Very important points there mentioned by Dr. Teku. Dr. Avinash, if I can come to you next. So what are the symptoms one needs to watch out for? If you have had comorbidities and you've taken steroids, we understand that if the black fungus is only detected in later stages, there's very little one can really do. People are losing eyesight, if not their lives. So what are the immediate steps and symptoms one should watch out for?
Yeah, the mucormycosis which are now observing are mostly the rhinocerebral. That means they enter from the nose. So you get some lesions in the nose. Your nose gets blocked. Start getting discharge, a blackish discharge through nose. The sinuses which are next to your nose, usually the cheekbones, they get inflamed, get pain. Eyes get also inflamed, and the upper and lower eyelids get swollen, and all these things happens very rapidly. Patient gets severe headache, then fever and severe pain. Some people also, we also observe some lesions in the palate of the mouth, the upper palate. So all these things are seen. You have to rush to the hospital for the diagnosis and treatment, because this has got very high mortality rate, very high infectivity rate. So it spreads very rapidly. You have to reach the hospital very fast and get it diagnosed at proper place.
All right, so watch out for those symptoms and stay in touch with your doctor. The point is that you have to be careful about what you're administering. Remember, all these steroids have multiple side effects, even long term. So you need to be careful about all of that. Thank you both for joining us with your perspective on this. We really hope the viewers are watching and taking tips from all of this.